Alison Bested. Hello, Alison.
Hello.
Now, can you tell the viewing audience and the people at home who may be watching why we're here today and what's going on behind us back here?
Yes, we're here to bring awareness about myalgic encephalomyelitis or chronic fatigue syndrome. There are over 400,000 people in Canada who have this illness and currently are not being helped either by the medical system or by research because doctors have not been taught about myalgic encephalomyelitis either in medical school or graduate school, and as a result the patients do not get a diagnosis and they do not get help from their medical system.
So it's like a quiet suffering at home that you have to do by yourself pretty much.
Absolutely. So patients don't get a diagnosis, or they might get a diagnosis as depression because a lot of the symptoms overlap, but this is a physical illness that's based in reality and based in physiology as opposed to a mental illness. Patients can have both. You can get depression as well as anxiety. However, this is a physical illness and patients need help and they need a diagnosis.
Now, what are some of the things that someone, like let's say I'm at home on the couch and I'm watching this interview, what are some of the things I personally might look for to see if I may actually be a sufferer from these things?
Yes. There is the Canadian consensus criteria that was developed in order to help diagnose patients. So there are 7 criteria. The criteria are severe fatigue, severe post-exertional fatigue. If you push yourself beyond your available energy, you crash or you have a relapse of your symptoms, you have a sleep disorder, you go to bed exhausted, you wake up exhausted. You have often pain that's of new onset, new headaches or muscle pain that migrates. You have cognitive difficulties, which is difficulties thinking, remembering, short-term memory problems, difficulty multitasking, and you also have other symptoms that are in your autonomic nervous system. Your blood pressure, it's difficult to maintain it. If you stand up, you may feel dizzy or you may faint. You may have difficulty with irritable bowel symptoms. You may have chronic immune problems, including chronic sore throats, swollen glands, new sensitivities to chemicals, foods, or medications. And in order to make the diagnosis, as an adult, you need to be ill for at least 6 months, and as a child, at least 3 months. So those are the Canadian criteria. But in order to make the diagnoses, you have to have those criteria met, but you also have to have had ruled out all the other diagnoses that can cause these symptoms, such as endocrine problems like low thyroid, cancers, addiction problems, sleep disorders. So it's a diagnosis of ruling out other things that cause the symptoms and also ruling in the criteria that actually.
I have a question. How can there be criteria to meet when they're not acknowledging that there's a problem to begin with? Like, I don't understand. If they're not going to say to you, clearly there's something needs to be done here, but you have to meet the criteria to fall into the category for this illness, well, then clearly there's an illness here, no?
Yes, absolutely. There is an illness, but the problem is that it's not diagnosed by doctors because doctors have not been taught in medical schools how to use the criteria. Therefore, they're not clear on how to make the diagnosis and how to treat the patients.
So there's more than just support needed, there's change needed as well.
Yes, there's change, education of the doctors, education of the system, education of the healthcare workers, education of the CCAC, which are the healthcare providers, because a lot of them think the patients are depressed and they just need to be pushed and gotten up out of bed, whereas the opposite of true. Patients need to be paced and basically maintain the energy they have but not push themselves, otherwise they have a relapse of their symptoms.
You're just back at ground zero.
Absolutely. If you want to get a diagnosis, the best place is to get your family doctor or your specialist to refer you to the Environmental Health Clinic at Women's College Hospital, and there are specialists who have a special interest in myalgic encephalomyelitis or chronic fatigue syndrome, fibromyalgia, and multiple chemical sensitivities. And these are the only doctors in Ontario who have a very small clinic. There's less than 1 full-time equivalence there. They're trying to meet the needs of the patients of all of Ontario.
And there's, like the sign says, we're missing millions of people from this disease.
Absolutely. So we have at least 400,000 people that have been diagnosed with myalgic encephalomyelitis, and that's according to the Canadian Community Health Survey of 2010, and that's where patients were asked, have you been diagnosed by a medical professional? But we know statistically from the literature reviews that 80% of patients do not have a diagnosis. So it's much more common than that. And in the physician's office, the patients 10% of those patients are so ill they cannot even get out of bed to get to their physician's offices. So we have real work ahead of us.